Can heavy implantation bleeding be mistaken for a period?
Hello, and welcome to our latest health education video. Today, we're going to tackle a frequently asked question, especially among those trying to conceive. Can heavy implantation bleeding be mistaken for a period? This is indeed a crucial question, as recognizing the difference can often be the first clue in the exciting journey of pregnancy.
What is implantation bleeding?
Implantation bleeding is a small amount of spotting or bleeding that some women experience around 10 to 14 days after conception. It happens when the fertilized egg attaches itself to the lining of the uterus. The bleeding is usually quite light, and the color can range from pink to red to brown.
How can you distinguish it from period?
There are a few key differences between implantation bleeding and menstrual bleeding. 1. Timing. Implantation bleeding occurs around the time you would expect your next period, but it can occur a few days earlier. 2. Color. As mentioned before, implantation bleeding can be pinkish or brownish, while menstrual bleeding is typically bright red at the start and then darkens. 3. Flow. Menstrual flow is usually heavy and lasts a few days, while implantation bleeding is typically lighter and more fleeting. It can last from a few hours to a couple of days. 4. Cramping. While both implantation and menstruation can cause cramping, cramps associated with implantation are usually lighter and less intense.
Can heavy implantation bleeding be mistaken for a period?
The simple answer to this question is, yes, it's possible. While implantation bleeding is typically light, some women may experience heavier spotting. It's also important to keep in mind that everyone's menstrual cycles and bodies are unique, and the way one person experiences implantation bleeding can be vastly different from another.
When should you consult a doctor?
While implantation bleeding is usually harmless, you should seek medical attention if the bleeding is heavy and accompanied by severe pain or cramping, or if you're worried about your symptoms. It's always a good idea to consult your healthcare provider in case of any concerns related to your reproductive health. We hope this video has been helpful in differentiating between implantation bleeding and irregular period. It's essential to listen to your body and seek medical advice when in doubt. Your journey to conception can be full of questions, but remember, there's always guidance and support available. Stay healthy and take care.